address you first. Joining Dr. Tedros in the room are Dr. Mike Ryan, Executive Director, Emergencies Program, Dr. Maria von Kerkhove, Technical Lead for COVID-19, Dr. Mariangela Simao, Assistant Director General, Access to Medicines and Health Products, Dr. Sumya Swaminathan, Chief Scientist, Dr. Bruce Aylward, Senior Advisor to the Director General, Lead ACT Accelerator. The briefing is being translated simultaneously into the 6 UN official languages, plus Portuguese and Hindi. Now, without further ado, I will hand over to Dr. Tedros for his opening remarks. Dr. Tedros, you have the floor.
Thank you. Thank you, Fadila. Good morning, good afternoon, and good evening. With the Northern Hemisphere flu season approaching and with cases and hospitalizations increasing, many countries find themselves struggling to strike the right balance between protecting public health, protecting personal liberty, and protecting their economies. So-called lockdowns and the impact on global travel and trade have already taken such a heavy toll. The global economy is expected to contract by trillions of US dollars this year. Many countries have poured money into domestic stimulus packages, but these investments will not on their own address the root cause of the economic crisis, which is the disease that paralyzes health systems, disrupts economies, and drives fear and uncertainty. We continue to urge countries to focus on 4 essential priorities. First, prevent amplifying events. Second, protect the vulnerable. Third, educate, empower, and enable communities to protect themselves and others using every tool at their disposal. And fourth, get the basics right. Find, isolate, test, and care for cases, and trace and quarantine their contacts. This is what works. Effective vaccines, diagnostics, and therapeutics will also be vital for ending the pandemic and accelerating the global recovery. But these life-saving tools will only be effective if they're available for the most vulnerable equitably and simultaneously in all countries. The Access to COVID-19 Tools Accelerator is the best bet for speeding up the development of the tools we need to save lives as fast as possible and to make them available for as many as possible, as equitably as possible. Today, WHO and our partners are publishing a detailed strategic plan and investment case for the urgent scale-up phase of the ACT Accelerator, building on the success of the startup phase. The investment case illustrates some of the considerable economic benefits from accelerating the development and deployment of tools to rapidly reduce the risk of severe COVID-19 disease globally. By the end of next year, the ACT Accelerator aims to deliver 2 billion doses of vaccine, 245 million courses of treatment, and 500 million diagnostic tests to low and middle-income countries. Today's status report shows that in just 5 months, the ACT Accelerator has made remarkable progress. The diagnostics pillar is evaluating more than 50 tests, including rapid and accurate diagnostics, and we expect to have more news on that next week. The therapeutics pillar is analyzing more than 1,700 clinical trials for promising treatments and has secured courses of dexamethasone for up to 4.5 million patients in lower-income countries, the only medicine shown to reduce the risk of death so far. And COVAX, the largest and most varied portfolio of COVID-19 vaccines globally, is supporting the development of 9 vaccines, and with several more in the pipeline. The number of countries joining the COVAX facility grows every day. As of today, 67 high-income economies have formally joined, and another 34 are expected to sign. Joining 92 lower-income countries who are eligible for financial support through Gavi. Investing in COVAX increases the probability of being able to access the best vaccine and hedges the risk that countries that have entered into bilateral agreements end up with products that are not viable. The ACT Accelerator is an unprecedented global effort. Of course, realizing its vision needs investment. The current financing gap for ACT Accelerator stands at $35 billion. $35 billion is a lot of money, but in the context of arresting a global pandemic and supporting the global economy recovery, it's a bargain. To put it in perspective, $35 billion is less than 1% of what G20 governments have already committed to domestic economic stimulus packages. Or, to put it another way, it's roughly equivalent to what the world spends on cigarettes every 2 weeks. Of the $35 billion, $15 billion is needed immediately to fund research and development, scale up manufacturing, secure procurement, and strengthen delivery systems. Normally, these steps are done sequentially. We're doing them all at the same time, so that as soon as a product is ready to go, we can get it to the people who need it immediately. We're not asking for an act of charity. We're asking for an investment in the global recovery. The economic benefits from restoring international travel and trade alone would repay this investment very, very quickly. Next Wednesday, world leaders will meet virtually for a high-level side event during the United Nations General Assembly to discuss the work of the ACT Accelerator and to call for the financial commitments to realize its promise. The window of opportunity is now. We must act now and act together to end COVID-19. I thank you.
Thank you, Dr. Tedros, for your opening remarks. We will now open the floor to questions from journalists. I remind you that you need to raise your hand, use the raise your hand icon in order to get in the queue to ask your questions. I will now give the floor to Mr. Du Yong.
Utilize multilateralism to beat the pandemic. Thank you.
Thank you, Mr. Young. I would like to give the floor to Dr. Ryan.
The World Health Organization was actually created as a multilateral institution by 194 member states. It owes its very existence to the idea of multilateralism, sharing of knowledge, collective responsibility for global health, and collective action to protect it. The work that we do today in every aspect of this response, the work that partners in the ACT Accelerator are doing around the world speaks to that mandate. It speaks to that responsibility, and one which we take very seriously. And therefore, yes, of course, this is a time that the Director General's speeches time after time. He's been calling since January, February for solidarity, science and solutions. And the ultimate expression of solidarity is governments acting together collectively and in a coordinated fashion to solve problems for all our citizens. And we very much welcome all of the commitments to that we've seen at the UN General Assembly from many, many countries over the last week.
Thank you, Dr. Ryan. We will move now to London, to Mr. Borzu Daragahi from The Independent. Can you hear me? Please unmute yourself.
Hi, can you hear me?
Yes, very well. Go ahead, please.
Great, I'm actually in Istanbul. I had a rather broad question about the impact of the COVID-19 pandemic on global medicine. Can any or all of you, if you would like, comment on how the pandemic, in your view, over the last 7-8 months has changed medicine in terms of recruitment, retirement, protocols, and what, if any, patterns have you seen within the medical communities regarding changes? Amnesty said earlier this month that at least 7,000 medical workers have died of COVID-19. I don't know if that's a total number, but how does a tragedy like that impact a profession as medical professionals yourselves?
Thank you. To respond to your question about the impact on health workers, I would like to give the floor to Dr. Edward Kelly, who is Director, Integrated Health Services at WHO. Dr. Kelly, you have the floor.
Thanks for the question. And the bottom line is that COVID has changed probably forever many things in our societies, but certainly it's changed the delivery of health services. Just last week with Dr. Tedros and a number of people here in the room, we celebrated World Patient Safety Day, the theme being safe health workers, safe patients, to talk about the impact of COVID and not just infections, but the stress and the mental health and also the new ways of working that have forced the medical community to adjust to COVID. Right now, in terms of what's reported to WHO, the healthcare workers in terms of infections have been about 14% of all the infections that are reported to us. There's limited data on this, but I think it's highlighted that we need to study more, and it's certainly put the spotlight on the fact that reforming and supporting health workers in all aspects, and we're talking about not just care deliverers, but the people who clean the rooms, the people who work in the community, in terms of outreach workers, have been majorly impacted. WHO's done a number of studies on this, looking at the essential health services and the continuity of those health services. There's been an impact across the board in terms of health services. About half of all health services at one point were interrupted, but it's everything from things that can be managed at some way, like dental services and rehab services, down to acute emergency services. So all countries right now are figuring out ways to make this work. WHO is trying to gather some of those experiences and share them as part of the response. And this will be something that we'll be working on with countries going forward.
Thank you, Dr. Kelly. I think Dr. Maria von Kerkhove has something to add.
Yes, thank you. I'd like to address the first part of the question that you asked about the bringing together of the medicine and how has that changed. I think one of the things we've seen, and WHO does a lot of work in this area of convening the world's scientific expertise and the world's leading experts on any number of topics that we are working on and responsible for. And this pandemic is no different. So quickly, we utilized our networks that have been in existence for emerging infectious pathogens like SARS, like MERS, like influenza, and brought that together to better understand what we were learning about this virus, around severity, around transmission, about clinical care, about everything that you could think of. And that was no different in this pandemic. But what that really allowed us to be able to do, and you've heard me say this before, we are working with thousands of scientists all over the world and all of these different international networks. But that really helped us to be strategic and smart about the type of studies that needed to be done. We had a meeting in early February under the R&D blueprint to have a research forum to say, what are the critical questions, the critical unknowns that need to be addressed under 9 different topics from from epidemiology to the animal-human interface to therapeutics, to virology, all IPC, so many different topics, and then pushed that science to be done, pushed those studies to be done, ensured that we had the right groups doing different types of research and not all doing the same research in one particular area, and then coming together regularly to discuss and debate, review all of the papers that are coming out. And I think that ability to be able to harness that world's expertise, not only to say these are the studies that need to be done, but to drive all the way through identifying the priorities, outlining the research methodologies that are critical to address those critical unknowns. And we have a number of protocols that are out to follow really high-level, robust methodology, everything from zero-epi through the clinical trials, to be able to get those answers quicker. But the science is really accelerating. I mean, 9 months, 10 months in, the science is coming fast and furious. And we work through our science division that Sumya leads, and with our partners and in the science division, but also the Goran Research Network, to review the studies that are coming out every day. And there are preprints that come out every day. They haven't gone through peer review, but there's hundreds of them, if not thousands of them. And the studies are becoming sharper. The studies are becoming more specific. They still need to go through peer review so that they go through that process. But we are working to pull all of that together and look at our guidance and look at our advice. And that's why our guidance and advice evolves. But I think that's a really good question, because this pandemic, again, just accelerates the speed at which WHO and our partners are able to come together and push that even further. So it's a process. Science never finishes. It's something that evolves over time and it grows, and that's a positive thing. And that's why our guidance evolves over time. But we're really grateful for all of our partners doing high quality research, taking the time to do it well, putting it through peer review, and making sure that they're addressing these critical unknowns.
Thank you, Dr. Van Kerkhove. Now the next question will come from Stephanie Nibehe, Reuters. Stephanie, do you hear me?
Yes, thank you, Fadela. Can you hear me?
Yeah, very well. Go ahead, please.
Thank you very much. I wondered if someone could elaborate, please, in terms of what I understood were the 67 countries that have joined, the self-financing countries that have joined COVAX, with, I think you said 34 more expected. Could you elaborate as to whether China is among those and whether Taiwan, which today said it had signed up on September 18th, is among those? And also, just as a corollary, we understand from a Chinese official today that WHO has, quote, supported its emergency use of vaccines. Can you perhaps comment on that, please? Thank you.
Thank you, Stephanie. Dr. Bruce Aylward.
Thanks, Fadela. Yes, so that's correct. Right now, there are it's an extraordinary number, and it changes every single day in terms of the number of countries that are working with the countries and economies working with the COVAX facility. As of today, as the Director General mentioned, it's 159 countries that have already confirmed, countries and economies, that they are going to be part of the COVAX facility. Of these, we've got 92 are what we call AMC eligible countries for support. And then we have the 67, what we call self-financing countries and economies. And of those, we have 29 actually have come together through what's called Team Europe. And in addition, there's another 34 that are still in discussion. So the final number could be well over 170 countries and economies that are part of this. And yes, indeed, Taiwan is one of the economies that have joined the COVAX facility, and which is great. We're in discussion with China as well about the role that they may play as we go forward in the with the COVAX facility, particularly in terms of the importance as a potential supplier of vaccines on the global scale. I think, as most people on the call are aware of, the all of the vaccines that are currently now in phase 3. 4 of these vaccines are vaccines from China. So again, an important potential player as we go forward. On the specific issue of the emergency use licensure, I think Marie-Angela.
Thank you. First of all, let me emphasize that countries have autonomy according to their national regulations and legislation to issue emergency use authorizations for any health product. And China and other countries have already done so for different products. And WHO has emergency use listing provisions and has issued already several products for diagnostics. We have not yet issued provisions for EOL of vaccines, but today I have good news for you because we have just published, put out for comments, a draft criteria for assessment of COVID-19 vaccines for emergency use listing or pre-qualification, and this will help manufacturers understanding the criteria, and also this is up for comments until the 8th of October, public comments, organizations, manufacturers, and individuals, because this will help to all partners to understand what's necessary to put a product that's both safe and effective into the market, and what are the elements that will make it eligible for either an emergency use listing by WHO or a pre-qualification. Thank you.
Thank you so much, Dr. Simao. The next question is from, I will give the floor to Robin Millard from AFP, Agence France Presse. Robin, can you hear me?
Hello, yes, can you hear me?
Yes, very well. Go ahead, please.
The world is approaching 1 million deaths from COVID-19. Is it unthinkable that 2 million might die before a vaccine becomes widely available?
Thank you, Robin. Dr. Ryan will take your question. Thank you.
It's certainly unimaginable, but it's not impossible, because if we look at losing 1 million people in 9 months, and then we just look at the realities of getting vaccine out there in the next 9 months, it's a big task for everyone involved to, as Marianne just outlined, the issues of listing, there's the issue of scale up, there's the issue of funding these vaccines, there's the issue of distributing these vaccines, and then the issues of acceptance. And beyond that, with the work we still have to do in controlling this disease. And remember, we have things we can do now to drive transmission down and drive down the number of deaths. We're seeing clinical case fatality rates slowly drop. We're seeing doctors and nurses making better use of oxygen, better use of intensive care, the use of dexamethasone, which again was referred to in the DG speech, and which the ACT Accelerator will provide a lot of focus on, and other therapeutics as they come online. So it is, 1 million is a terrible number, and I think we need to reflect on that before we start considering a 2nd million. There is a lot that can be done to save lives, both in terms of disease control, existing life-saving measures, and the innovations that are coming down the pipe. The real question is, are we prepared collectively to do what it takes to avoid that number? Are we prepared to fully engage in the surveillance and testing and tracing, in managing our own risks at society and community level, governments supporting communities to take that action? Are we willing to make the investments now that are needed in the ACT Accelerator, especially in COVAX? Because these are the, number one, the investments we need to make and the actions we need to take at all levels of our society, both subnationally, nationally, and internationally. Are we willing to take the multilateral action, the collective global action, to take control of this virus rather than this virus controlling our destinies? If we don't take those actions and we don't continue to escalate and evolve the nature and scale and intensity of our cooperation, yes, we will be looking at that number, and sadly, a number much higher. So the time for action is now, on every single aspect of this strategic approach. The DG has said it again and again and again. Not just this, not just test and trace, not just clinical care, not just social distancing, not just hygiene, not just masks, not just vaccines. Do it all. And unless we do it all, the numbers you speak about are not only imaginable, but unfortunately and sadly, very likely.
Thank you, Dr. Ryan. Dr. Edward has something to add.
Yeah, thank you very much, and thanks for the question, Robin. I think we have to be super clear. Whether another million people die of COVID-19 is not a function of whether or not we have a vaccine. It's a function of whether or not we put the tools and approaches and knowledge that we have today to work to save lives and prevent transmission. It's as simple as that. And if we start thinking about it as a function of the vaccine, people will unnecessarily and unacceptably die as we wait for a vaccine. We should not be waiting. We have made incredible progress in terms of reducing mortality from this disease, in terms of preventing the most vulnerable and the highest risk from getting infected by this disease. It's unacceptable, it's unnecessary, and it should be unimaginable. And it should not be a function of whether or not we have a vaccine. It's a function of whether or not we, as individuals, as Mike emphasized, do what we can, our part, to prevent transmission of this disease.
Thank you, Dr. Elward. The next question is from Ana Pinto, Folha de Sao Paulo. Ana, can you hear me?
Thank you, Fadila, and good afternoon, everybody. My question is about how to talk to young people. The European Commission said yesterday that this is the last chance to avoid new lockdowns like those imposed in spring, and called for the young people to comply with the physical distance rules and protect themselves and protect others. But I guess we have seen that it's not lack of information. So information is not enough to change people's behaviors. So since early this month, the WHO convened its special group on behavioral science. I wonder if there are already any insights about the best way or the most promising ways to get people to really take care of themselves and others, especially younger people who seem to believe that COVID-19 is not such a big deal. Thank you.
Thank you, Anna. Dr. Ryan?
Yeah, I think I take your point, but again, we run the risk here of, when you say young people, you mean all youth, and they're all of the same mind, and none of them want to cooperate. I think that's where the older people get it wrong, quite frankly. The vast majority of young people that I know are just as committed to containing this disease and saving lives as anybody else. In fact, more committed, just as knowledgeable, as you say. The issue is when it comes to behavior. You may have the knowledge, you may have that attitude, you may wish to take the best possible action, but then it's how you actually behave in the end. And there are many factors that eventually drive human behavior. And we have to understand also, and not to get into a blaming culture, we have to see how we can support youth, like we support any sector in our society, to protect themselves and protect others. So I really hope we don't get into a sort of finger wagging, it's all because of the youth, and therefore they need to improve their behaviors, so we need, you know, that is not a dialogue that is going to work. It certainly never worked with me. So I think we need to have a conversation, and the youth need to lead that conversation. And the last thing a young person needs is an older person pontificating and wagging their finger. So I think we need to find better ways to engage young people. I think we need to give young people the responsibility and give them a voice in this, and then empower them and resource them to do it. But in the end, when we look at some of the situations around the world, if we leave aside who's doing it, the reality is that indoor, close together gatherings of individuals engaged in intense activity over a prolonged period of time is a major factor in driving transmission at community level in this epidemic. And therefore, we have to make those environments.
Dr. Mark Ryan of the WHO live at the briefing in Geneva, which of course takes place almost weekly about the latest situation on COVID-19, speaking about the antibody studies. I know a lot of what came out of that. The journalists were suggesting that on this particular issue that young people perhaps being behind the high transmission rate, the WHO saying through its genome sequencing studies they have found that their youth do account for some of the transmissions, but that there is a huge difference sometimes from country to country, region to region. The Director General Tedros Ghebreyesus earlier on talking about the vaccine candidates, Covovax, one of them that he mentioned that more and more countries are signing up to that. Up to 1,700 clinical trials being examined at this moment as the globe deals with the fact that over 1 million people have died from COVID-19. Of course, the WHO did say that they are working on ensuring that the availability of the vaccine itself does not fall short of fairness, because there has been a lot of concern around the power dynamics of countries. In fact, that they are saying something as many as 2/3 of the world's population have joined the plan to buy the vaccines when they become available. Questions by scientists as to when they would be. Most of these vaccines in phase 3 trials, but when the first will become available, lots of speculation around that. And of course, the latest news being that South Africa has dropped from the global COVID-19 scale, is now ranked the country at 10th of the highest confirmation of infection rates. We'll continue having more detailed data for you on that. For now, let's tell you what the story is, big story, which is in